Hi, my name is Elena Warren, and I have a patient here who has something to say.
I give my consent to be recorded and the video uploaded into a video cloud platform for the exclusive use of the assessing of students' competency in the Advanced Health Assessment course at MU.
I'm going to first note that the patient's head seems normocephalic. It's round, no signs of trauma. I am going to note that the features that are supposed to be symmetric on the face are, and midline features are found midline. At any given point, if I'm touching on you, please let me know if any of this is tender so I can mark it in your chart. Alright, no palpable masses. Scalp is no redness, no lesions. Seems to be no issues there. I'm going to come around to the face, kind of feel here. I do note that there is a star-like flesh-toned scar on the left eyebrow here. No tenderness. Open and close. No crepitus with the joint there. Okay. So now I'm going to feel here. Here. And kind of move down. No tenderness. Alright. I am feeling no firm masses, no warmth or anything like that, no palpable lymph nodes really here. Let's get in deep, and then let's do these. Alright, no masses found. Everything seems to be within normal range there. I'm next going to move to the eyes. I'm going to do a couple of different tests. First, I'm going to look at them, have you look up. Sclera seems white. Intact mucosa, no drainage. I'm gonna have you look down. Alright, same there. Eyelashes, no crust or anything of that nature. Alright, I'm gonna start doing a couple tests. First, I'm gonna have you follow this in and back out, and then here, here. Alright, accommodation seems to be going good. Cranial nerves are tested and all seem to be responsive. No ptosis or nystagmus has been seen. I'm then going to test your visual acuity. I'm going to have you put this over one eye. Can you read the lowest line? I'm at 6 foot like the chart suggests. Can you read the lowest line with confidence?
LT.
20 out of 100 noted for the left eye. Can you please switch eyes for me? Alright, lowest line with the most confidence.
LTFPH.
20 out of 70 noted in the right eye. Tell me when you start to see my fingers.
Okay. Right there.
Alright, peripheral vision test is complete. Everything seems to be within normal range there. Got some bright lights coming at you. I'm going to shade this area and then expose it to light. Okay. Do the same on this side. Expose it to light. Alright, those seem to be, pupils are equal, round. They were accommodating. They reacted to light. And now I'm going to do the red light reflex. If you could just look past me a little bit. Perfect. And I'm going to come around and do this side. Alright, both are noted in each eye. Now I'm going to take a look at your optic nerve, another bright light. Alright, I'm going to look forward for me. I'm going to pull your lid up and kind of just look with this bright light. The same on this side. Alright. Optic nerve on both sides seems to be round, well defined, in a pinkish orange tone. Now we're going to move on. Switch heads here. I'm going to take a look in your ears, okay? Alright, intact, no redness, minimal wax, intact membrane, tympanic membrane that is gray, cone of light, 5 o'clock. This side we're going to do the same thing. Pull the ear up, take a little look. Same thing over here, gray, intact. The canal is intact. The cone of light is at the 7 o'clock position over here. No drainage, minimal cerumen. Any ear pain? On this side? Perfect. You let me know if you hear this in one ear or in both, okay?
Both.
All right, you tell me when you stop hearing this.
No.
And again.
No. No.
Bilateral hearing found with the test, and bone and air conductivity is also within normal range. So now we're gonna mess with your nose. Any issues?
Nope.
Breathe in for me. And again. Both nodules seem to be patent and no issues there, no tenderness, no lumps. Septum appears to be midline, and now we're going to take a closer look. If you could look up for me. Moist, pink, not red, minimal. Can visualize tuberance, minimal drainage, no damage seen, no lesions, no bleeding. No palpable masses or anything of that sort. Now I'm going to poke around on your mouth, okay? So we're going to first look at the outside. The lips seem to be intact, pink. We'll have you open your mouth. Just going to kind of look around, tongue up and down, side to side. Tongue midline, no issues with movement. There is a line that is midline down the tongue. Tongue seems to be intact. Open again for me. No lesions. Let me look around. In the mouth. No lesions on the oral mucosa. No issues with the gums. No inflammation. Appears to be pink, not red. Moist. No missing teeth. Anything like that. Alright, can I have you stick out your tongue and say ah? Uvula is intact. Midline. Once again, everything is pink, not red. Moist. Say that one more time for me. Alright, no tonsils are noted, no signs of infection, pus, or anything like that. No masses in the neck. No tenderness here. I'm going to have you look back. Trachea is midline. So now I'm going to kind of do a funny feeling exam. I'm going to find this right here. I'm going to push around on your thyroid, okay? Push it to the side, feeling no nodules. Push it to the side, feeling no nodules. I'm going to kind of push on both sides, and I'm going to need you to swallow for me. All right, no nodules were noted at this time. Kind of check out the skin a little bit. I see the areas that are exposed, small, scattered, nevus-like or freckle-like pattern, especially sun exposed areas. I see a couple scratches, nothing that shows sign of infection or like leaking or pus. I see tattoos on the upper forearms here. I'm going to kind of look down. Something is covered there. No clubbing of the nails. Capillary refill, less than 2 seconds. Capillary refill is going to be less than 2 seconds. Let me grab my stethoscope. I totally forgot. We're going to be listening a couple places here. Alright, I'm going to touch on them. No bruise reported, no thrills reported in either the carotid